Judy and Adam, we know that about 50 to 75%, those are the estimates, of physicians really don't know anything about MACRA. So what should organizations be doing to educate and engage their physicians in MACRA?
Ideally, organizations would already be engaging with their physician colleagues on any number of process improvement and quality improvement activities. If so, this seems like it would be a logical next step to address the changes that are in this statute in their conversation. If not, this provides a very compelling opportunity to start to work together. The changes, as we've heard, are quite material from the standpoint of transforming the way care is provided and the way that reimbursement is provided for the care that we do. But I think a good place to start would really be to start talking about data. The big difference between now and back before in the HMO days really constitutes and circles around data. Before, the efforts on care change were focused on just reduction of consumption, reduction of utilization, and that was it. There wasn't much data about quality. Now we're really seeing that the value is the proposition, meaning the quotient between quality and cost. And along with that comes the necessary data aggregation. So regardless of the path that people choose to move down, having actionable data about the quality of care that's being provided is going to be critical. And when I say actionable, here's what I'm talking about. We're used to looking at spreadsheets and numbers that say a population of patients in our health system or in our group as a whole has say a hemoglobin A1C value of 7.6 as on average. Well, I don't know about you, but I can't treat an average patient. I can only treat individual patients. So for the data to be actionable, you have to be able to take that data and boil it down to specific individual patients in a physician's panel. I recently had an opportunity to observe a rowing competition. And there were some interesting things as I was watching this rowing competition that came to mind. Obviously, the goal of rowing is to try to get faster and beat the other rowing crews. But in order to do that, the focus is not on the whole crew. The focus is on coordinating the efforts between the members of the crew and on the optimization of each and every individual stroke in the rowing. Population health is similar to that. We can talk about the overall performance of the crew and as we approach the populations that we're entrusted with. But in order to really impact that, we have to focus on the coordination and focus on optimization of each and every stroke, each and every opportunity that we have to care for the patients that we have. So it's not just the team that wins, it's actually the patients.
Judy, what do you think?
Adam, that's a great analogy. Kevin, your question about educating and engaging physicians on MACRA, what can an organization do? I look at it as the first task being to provide information and really make it ubiquitous. First of all, give us a glossary of terms so that the acronyms make sense to all of us, right? And even the longer terms. And make information available both on a push and a pull basis so that if a physician is ready at that moment to gather more information, it's available for them. They can pull it to themselves and provide it in different formats, provide webinars, tables, charts, graphs, text. People learn in different ways, people absorb information in different ways and may have different needs at different times. Provide ready access to a host of useful links with accurate, precise information, and make sure that the physicians in the organization are confident that they're people on top of the upcoming changes and that the information they pull to themselves will be accurate in real time. Also provide certain opportunities for pushing information at folks so that people who don't on their own go and seek out new information are aware of the key changes that are coming. The second key, in addition to making information ubiquitous, I think, is emphasizing that this is really about choices. Physicians have a host of choices to make all throughout the strategy and implementation of this program, and assure that each physician understands what the degrees of freedom are within which they can make those choices. And I think we'll be talking a bit more about that as we go. But one of the useful things, I think, is to recognize that a physician can really tailor this to his or her practice in many instances. Certain aspects of the program are very tailorable, others of them perhaps less so. And finally, as an initial implementation piece for educating and engaging physicians, I'd emphasize clarity around role. Who is going to do what, or what category of the organization is going to focus on which parts, so that physicians can focus on the piece that we are most expert at and be confident that experts in other areas are going to be addressing those other key important components of MACRA so that we implement it in an optimal way on behalf of our patients.